Much obliged, Honorable Speaker. I rise to debate in moderation of the motion on the floor of the House. I'll give a measured input into the debate on the floor of the House. Mr. Speaker, health services in the country are provided across a continuum of care, and health facilities are graded. Health facilities will either provide public primary health care facilities or public primary health care services or tertiary level health services. Health services in the country are provided across the continuum of care, beginning with promotive health services, preventive health services, curative health services, and Mr. Speaker, across the continuum of care. Rehabilitative health services are also provided across the continuum of care. Mr. Speaker, when we look at public health facilities that are accredited to provide primary health care services, they will work during a particular period of the day. Mr. Speaker, when it comes to emergency hospital services or emergency health services and tertiary health services, hospital services, all public health facilities in the country operate 24 hours. Now, Mr. Speaker, we must understand one aspect. The distress of our Member of Parliament who has brought the motion to the floor of this House is that in his constituency, there are primary health care facilities that close at 14 hours and at 15 hours. Now, that is a matter that needs to be addressed as an isolated item. And Honorable Minister of Health is summoned to ensure that that is resolved, because primary health care services must be provided between 7 o'clock and 16 hours, and not 14 hours. All hospitals in the country, the government that preceded that government ensured that the policy was that you operate 24 hours. Not only hospitals operating 24 hours, Mr. Speaker, even pharmacies in these hospitals were ordered to operate 24 hours. Why? Because there are people who are either students and cannot attend clinics, specialist clinics in the morning, or they are CEOs or executives in parastatals or in government, and they don't have time to attend specialist clinics in the morning, but they're still required to refill their drugs at a particular time of the month or week. So they don't need to come to the facility at 9 o'clock. Pharmacies dispense even at midnight. You can go to UTH today and get your ARVs at midnight. This is the reason why we even established the ART clinic on Saturdays and Sundays, to ensure that students, busy executives, are able to access these health services outside their routine professional work. Mr. Speaker, I must emphasize that it was not meant to introduce services for gays. No, it was meant to introduce services for everyone. So, Mr. Speaker, universal health coverage demands that we provide health services for everyone, everywhere. And therefore, we must configure health services to be available at all times. But each facility is accredited to provide a particular level of service. So primary health care services that include antenatal health care services, under 5 clinic, and the basic clinical care services will be available during a period of time. And the number of, or the human capital available at that facility will be such that they'll be able to work during a certain particular period of time. Yeah. But for hospital services, Mr. Speaker, the policy of the government before the current government was that all health facilities at that level would operate 24/7. And we went beyond that core and included even pharmacies. And that's the reason why, when you check the indicators towards epidemic control of HIV/AIDS, you find that we were able to put more than 90% of all HIV-positive patients on ART.
Motion is non-controversial, and it seeks to save your people
Order.
and my people. I thank
Time
you, Mr.
is up.
Speaker.
Honorable Member for Zambezi East, followed by Minister of Education.
Mr. Speaker, I thank you sincerely for giving me the opportunity to contribute to the motion that was moved by the Honorable Member for Kamfinsa and seconded by the Honorable Member for Chipidi. Mr. Speaker, most of the technicalities have already been said, and I would like to adopt the debate delivered by the Honorable Member for Lukulu, Honorable Dr. Kalila, as mine. In the same vein, I would like to adopt approximately 80% of the debate that was delivered by Dr. Chitalu Chilufya as mine as well. And my father taught me that when the bishops have spoken, you as a deacon, you just summarize and deal on the substance that will help sink the message into those who are listening. And that's exactly what I'm going to do, because the people who technically deal with this topic have spoken enough of the technicalities. Mr. Speaker, in trying to spice up the debate, I'd like to explain a little bit, because I had, I think, a stint in the Ministry of Health, Central Board of Health then. Health services in this country, as rightly put by the technical people, are actually divided into, on a continuum, as he stated it. There is the primary health care, which is synonymous with the people coming from the house and coming to seek medical services. Primary as the word sounds. And most of this is found at the health centers, health posts, mini hospitals, and almost all the first level hospitals, those which you call as district hospitals. Some of course, these high-level hospitals also offer some primary health care. By primary health care, we are talking of issues to do with treatment, issues to do with health promotion, issues to do with, prevention. In that line, you have these health workers dealing with prevention. You're talking of environmental health technologists. Dealing with the treatment, you're talking of clinicians, clinical officers, and nurses in those institutions. And also those dealing with health promotion, environmental health technologists, including maybe maternal child health nurses and the like, who offer under 5 and the like. That